So if you think back to recent global events, especially the huge shock we all felt during the COVID-19 pandemic,
Hmm.
it really painfully exposed something we often just take for granted, didn't it?
It really did.
This unseen critical layer beneath our health and well-being, these foundations that, well, you only really notice them when they start to crack.
It was such a stark reminder, wasn't it, that the things we don't see working every day, like solid disease surveillance or clear public health guidance, are often just as vital, maybe even more so, than the immediate care we can see.
Absolutely. And that invisible foundation is exactly what we're diving into today, this crucial concept of common goods for health, or CGH.
Right.
And our deep dive today, it's mostly based on a really foundational 2021 guidance document from the World Health Organization. It's called, quite simply, Financing Common Goods for Health.
Yeah, it's a key text. And our mission really is to unpack what these common goods for health actually are. Why are they so essential?
And why are they so often underfunded? That's the puzzle.
Exactly. And what does a sort of forward-looking agenda for health truly need?
We want to explore how understanding these elements can be, well, almost a shortcut to being incredibly well-informed about the hidden pillars holding up our collective health. So let's pull back the curtain. What exactly are these common goods for health?
Okay, so at their core, the WHO defines them as population-based functions or interventions. And the key thing here is that they fundamentally require public financing.
Public financing.
Yeah, that's crucial. They don't just contribute to human health, but also to long-term economic progress. And the reason they typically need that public funding, it boils down to what economists call market failures.
Market failures. Okay, for someone like me, maybe without that economics background, what's the simplest way to think about that? Why does that make public funding so necessary? Is it like trying to, I don't know, charge everyone for breathing clean air?
That's a great way to put it, actually. Often, these functions are either public goods, meaning everyone benefits simultaneously, and you can't really stop anyone from benefiting, even if they don't pay. Think like national defense or maybe a lighthouse.
Right, non-exclusionary.
Exactly. Or they have what we call large social externalities. This just means the benefits ripple out way beyond the person directly involved. The whole community or even the whole world benefits.
Yes. So if it's a CGH, everyone benefits, and you can't really bill people individually for that benefit. Okay, that makes sense for public funding now.
Precisely. And it's also important, to be clear what CGH or not. They're different from common pool resources like the air itself or a fishery or a forest.
All right.
CGH help protect those resources. Think environmental regulations for water quality that protect clean water, but they aren't the resources themselves.
So it's the actions, the interventions, the systems around those resources.
Yes, exactly, the active measures.
Yeah.
And they also generally exclude personal health services delivered one-on-one to individuals. Well, unless that specific service carries those really big externalities, those ripple effects that go way beyond just the direct benefit to that one person.
Okay, this is where it gets really interesting and maybe a bit counterintuitive. Let's talk about vaccination. Because we often think of getting a vaccine as, an individual choice, something maybe you pay for yourself. How does that fit into common goods?
Vaccination is a fantastic example, actually. It clarifies this distinction beautifully. So, yes, individuals might pay for some vaccines out of pocket,
Right.
but the critical CGH functions that support the whole vaccination effort, that's things like the basic research and development that creates the vaccines in the first place.
Years of work, yeah.
Absolutely. Then there's the surveillance systems tracking diseases, community engagement, public information campaigns to build trust.
Safety regulations, quality control.
All that, and the overarching vaccination policies themselves.
So it's not just the jab in the arm. It's this huge ecosystem supporting it, the R&D, the global networks, the trust building. It's like the vaccine itself is just the tip of the iceberg.
That's a perfect analogy.
And the common good is that massive unseen part underneath.
Exactly. And the presence of those large social externalities, especially preventing transmission, achieving herd immunity that fully justifies public financing for things like the vaccine cold chain or subsidies to make sure cost isn't a barrier for anyone.
It really makes you think, doesn't it? When we talk about health spending, what chunk of it is truly delivering that kind of collective benefit?
It's a fundamental question.
Which leads right into the paradox.
Yeah.
If these CGH are so important, why are they so often underfunded?
Yeah.
underprovided.
Yeah, it's a tough one. It really stems from both those market failures we talked about. It's just hard to put a price on clean air or good disease surveillance, and also what we call collective action failures.
Collective action failures.
Basically, the benefits are often invisible to individuals day to day, or they're far off in the future, like preventing a pandemic that doesn't happen because we invested.
Right. The classic out of sight, out of mind problem.
Exactly. And that gets amplified by political cycles. Politicians often get rewarded for visible, immediate things, like opening a new hospital wing.
Rather than the long-term preventative stuff that stops a crisis we never even hear about because it was averted.
Precisely. So there's often less public demand, less political incentive to prioritize these investments over more tangible, immediate issues. Overcoming that requires a real shift in how we value prevention and collective security.
That makes a lot of sense. Okay, so to help us sort of get our heads around this whole area, the WHO guidance breaks CGH down into 5 broad categories. You mentioned they're not mutually exclusive, which is important.
Yeah, there's overlap.
So let's walk through them. What's the first category?
The first is policy and coordination. So this involves things like setting national health policies, building up the government's capacity, its institutional muscle, if you like, and creating those coordination mechanisms that work across different sectors: health, environment, agriculture, and also across different levels of government.
Okay, so this is where you'd find things like planning for emergency preparedness and response, or setting policies on health security risks.
Exactly. Also, crucial things like community engagement strategies and those really important One Health approaches.
One Health.
Yeah.
That's about recognizing the link between human, animal, and environmental health,
Yep.
right? For things like zoonotic diseases or antimicrobial resistance.
Precisely. Tackling those interconnected threats. Okay, second category, regulation and legislation.
Right. This sounds like where the government uses its authority.
It is. This uses the government's power to make rules through laws, decrees, administrative rules. Think about regulating the safety and quality of medicines and medical devices.
Yeah, that's huge.
Environmental regulations for air and water quality. Accrediting health facilities and providers to make sure they meet certain standards.
And also laws controlling advertising for things that harm health, like tobacco or maybe sugary drinks.
Absolutely. Controlling promotion and sponsorship, too. That all falls under regulation.
Yeah.
Then number 3 is taxes and subsidies.
Okay, so not just raising money,
Yeah.
but using finance to influence behavior.
Exactly. These are financial tools designed specifically to shape individual choices and market behavior towards better health outcomes.
Like tobacco taxes, for instance.
Perfect example. Taxes on tobacco, alcohol, sugary drinks, they create price signals to discourage consumption. But it also includes things like environmental taxes, say a carbon tax. And on the flip side, pro-environmental subsidies, maybe helping vulnerable households afford cleaner fuels or better sanitation infrastructure. It's about making the healthy or safe choice the easier, more affordable choice.
Makes sense. Number 4.
Information collection, analysis, and communication. This is absolutely fundamental.
Yeah, you can't act if you don't know what's happening.
Precisely. So these CGH are all about systematically collecting and analyzing data to track population health. Think human and animal disease surveillance, vital for everything from flu outbreaks to tracking antimicrobial resistance. Also includes comprehensive national health management information systems, crucial R&D, and broad health promotion campaigns to inform the public.
And what's interesting here, the WHO includes things like transparent and free media, and even fostering environments for whistleblowers and civil society. That really broadens the idea of information for health.
It really does. It recognizes that information flows through many channels. Okay, finally, the 5th category, population services.
Population services, what falls under this?
These are services that impact pretty much everyone in society. They're fundamental to public health, but markets either just don't provide them or don't provide nearly enough.
Like large-scale sewage treatment.
Exactly. Sewage treatment and control. Vector control programs managing mosquitoes, ticks, etc. Proper medical and solid waste management. And the actual infrastructure and operations needed for emergency response.
These feel really foundational, almost invisible, like you said, until they're not there.
Absolutely. So these 5 categories, they provide a framework, really, to help governments think about budgeting and planning to make sure these critical, often unseen functions get the attention and funding they need.
It's clear then that supporting these common goods needs, well, action on many fronts. The WHO document really pushes this idea of whole of government and whole of society approaches.
Yeah, it's not just a buzzword. It means genuinely breaking down those traditional silos between ministries and agencies.
Because a health crisis isn't just a health ministry problem, right?
Exactly. Think about a pandemic. It hits the economy, disrupts education, raises security concerns. You need finance, agriculture, education, community leaders, everyone working together.
And this action happens at different levels, too.
Absolutely. CGH functions, and the money for them can be global, like knowledge sharing, pandemic treaties, regional CDCs, national, like regulating health services or managing waste nationally, and right down to the subnational or community level local awareness campaigns, engaging communities directly.
We saw an example, a cautionary one, with Kenya's experience after decentralization.
Yes, that's a really telling case. After they decentralized governance in 2013, things like emergency preparedness and health security weren't consistently prioritized in the new county budgets.
Leading to a patchy response when disasters hit.
Right. It really highlights how vital clear coordination and funding mechanisms are across all levels. Otherwise, crucial functions can just fall through the cracks.
And it's not just different government levels, it's different sectors, too. You mentioned health, agriculture, environment.
Education, finance, justice, the list goes on. Responsibility often spans multiple sectors.
Which brings us back to that one health approach.
Indispensable for this. It explicitly recognizes that human, animal, and environmental health are all linked. It stresses that data like epidemiological tracking, lab results, must be shared across sectors to effectively prevent, detect, and respond to emerging threats. It's a truly holistic view.
Is there a good example of a country doing this multi-sectoral coordination well in practice?
Australia's program budget system is often cited. It's quite insightful.
How does it work?
Well, they actually allocate dedicated funds from general taxes specifically to outcomes like health regulation, safety, and protection. And they have clear KPIs like disease surveillance coverage or immunization rates.
Okay.
But the really clever part is how the budget for those health outcomes is directly linked to spending and activities in other departments, like agriculture and water resources for biosecurity or environment and energy for handling hazardous waste.
So it builds the collaboration right into the budget structure.
Exactly. It's a practical demonstration of that whole of government idea in action.
So let's talk financing. How do we actually fund these often invisible goods?
Mm-hmm.
Overcoming that out of sight, out of mind problem seems like a huge hurdle.
It is a major challenge. A key step is to really integrate the financing agenda for CGH into the regular mainstream budget processes, the annual budgets, the multi-year plans, not treat it as some kind of optional extra.
Right, make it core business.
Exactly. And effective financing usually requires pooling resources somehow and definitely strong coordination. Things like health sector, medium-term expenditure frameworks, or public expenditure reviews can help governments plan strategically over the longer term rather than just reacting year to year.
And does it require changes to how budgets are managed? Moving away from old-fashioned methods?
It often does, yeah.
Yeah.
Countries can benefit from moving away from, say, really rigid line-item budgeting that just focuses on inputs, salaries, supplies, instead moving towards more flexible approaches that focus on outcomes.
Mm-hmm.
Giving direct transfers to autonomous agencies like a National Food and Drug Administration can also build their capacity and independence.
And what about in countries where power is very decentralized?
That's a critical point. In those settings, conditional transfers can be really useful. That's where the national government provides funds to subnational levels, but with specific conditions attached to ensure that money supports CGH priorities. It helps steer local decisions.
But what about the really tough cases? Fragile states, places affected by conflict, where government capacity is just incredibly weak. How on earth do you finance CGH there?
That's an enormous challenge. There are no easy answers. Solutions often involve a mix of things. Very targeted efforts to build local capacity, careful coordination of funding from external donors and NGOs.
Trying to avoid duplication.
Exactly. And sometimes establishing temporary parallel systems or shadow processes that can deliver essential functions with the long-term goal of eventually transitioning these back to domestic institutions when stability returns. It requires immense adaptability and a long-term view.
You mentioned India's big sanitation mission earlier, the Swachh Bharat mission. It had innovative funding, right? Mandatory contributions.
It did, yes. Launched in 2014 to tackle open defecation, a huge public health issue. A significant chunk of funding came from things like service taxes and mandatory corporate social responsibility spending.
Sounds promising on paper.
It was a strong national push. But despite that, implementation and actual spending were quite uneven across India's highly decentralized states. It just underscores again how challenging that fragmentation can be, even with the national priority and dedicated funding streams.
So zooming out again, looking at the bigger health picture,
Yeah.
it's crystal clear that these common goods are the absolute foundation, not just for the health system, but for society overall, essential for health security.
Absolutely. And they aren't concepts floating in isolation. They mesh perfectly with other key health goals and frameworks.
Like what?
Well, health system strengthening, for instance. CGH provide the essential enabling environment for personal health services to actually work effectively. You can have great hospitals, but if disease surveillance is poor or water quality isn't regulated, the system struggles.
Right. It's the foundation that lets the rest of the building stand strong.
Exactly. They also provide the economic justification, the rationale, for the collective foundations needed for essential public health functions. Things like monitoring health trends, surveillance, disease prevention. And they fully encompass the benchmarks for global health security under the international health regulations, guiding countries on being prepared to prevent, detect, and respond to threats.
And how do they connect with the big goals of universal health coverage,
Yeah.
UHC, and primary health care, PHC?
They form the bedrock for UHC. They support the crucial health promotion and disease prevention aspects, especially through a primary healthcare approach. That PHC philosophy really emphasizes community engagement and social accountability.
Which are vital for collective action around common goods.
Precisely.
Thailand's journey towards UHC is a great illustration here, isn't it?
It really is. Back in the early 2000s, when they were reforming towards UHC, they deliberately set up the Thai Health Promotion Foundation.
Funded separately.
Yes, funded separately, specifically to focus on those population-based promotion and prevention activities tackling NCD risk factors, things like that.
So it complemented their main UHC scheme for personal health care.
Exactly. It showed a very clear, conscious recognition that you need both strong CGH and good individual services for a truly comprehensive and resilient health system.
Which brings us back, unfortunately, to the pandemic. It just so painfully highlighted the urgent need to invest in these interconnected population-based functions.
It really did. It starkly exposed the chronic underinvestment and the absolutely devastating consequences, health, economic, social ones, that result from neglecting these common goods.
But perhaps there's an opportunity in this crisis.
There has to be. This crisis, as painful as it's been, offers a critical window. It's absolutely essential now to tackle those financing and governance challenges that were laid bare. We have to address the constraints that stop us investing properly and delivering CGH.
So it requires urgent action, real commitment from everyone. Local, national, global levels.
Yes. Concerted action. We need to invest seriously in the common platforms that form the foundation for tackling both current and future health threats, because the cost of not doing so is just catastrophic, as we've seen.
And how do we make sure this actually sticks, that it leads to real change?
Well, for lasting change, this whole CGH agenda has to be properly mainstreamed, woven into entire government budgets through those multi-year planning and budgeting cycles we talked about.
Not just a side project.
Not at all. And crucially, strong accountability measures are needed. That includes broad-based monitoring by citizens, by civil society, to ensure that the political promises and the funding commitments actually translate into these essential common goods being delivered on the ground.
So, wrapping this up, what does this all mean for you listening in? If these common goods for health are so incredibly fundamental and the devastating cost of underinvesting has been so vividly, tragically demonstrated, why is it still so difficult for us collectively to prioritize these often invisible benefits over more immediate, more tangible concerns?
It's the perennial challenge, isn't it?
And maybe, what can you, as someone who's now more informed about this, do to champion these unseen foundations in your own community or maybe more broadly?
This deep dive, it's really just a starting point for understanding the true bedrock of a healthy society. The call to action, I suppose, is to keep exploring these ideas, keep asking questions.
And keep advocating for the common good, even when it's not the most visible issue on the table.
Exactly. Keep advocating to the common good.